Hi, my name is Faith Crane, and today I'm going to be talking about multiple sclerosis. Multiple sclerosis is an autoimmune disease that attacks the brain and spinal cord, and specifically it attacks the myelin sheath, which is a fatty layer covering axons on our neurons. This myelin sheath allows our neurons to communicate with each other faster, and it protects our axons. The functionality of this central nervous system rapidly declines with the destruction of these vital cells in our body, and this can cause cognitive impairment and sensory motor function issues. Unfortunately, there is no cure for MS currently. However, there are many treatment options in the form of drugs to help with MS attacks and lengthening remission time. With many of these drugs, there are some serious adverse effects. Two of these drugs that I will talk about today are corticosteroids and natalizumab. Corticosteroids can cause insomnia, hypertension, increase in blood sugar, and mood swings, which can obviously negatively impact the patient's life. However, natalizumab comes with much more serious consequences. Natalizumab can increase the risk for an infection of the brain called progressive multifocal leukoencephalopathy, which will cause patients to live on average of 6 months after diagnosis, but some have lived up to 2 years. And so a study was recently conducted looking into the use of umbilical cord mesenchymal stem cells. There were 20 people included in the study, and they participated in 7 intravenous infusions of umbilical cord mesenchymal stem cells over the duration of 7 days. After a year of this study, there were not many adverse effects. The only adverse effects reported was fatigue and headaches, and both were very mild and not proven to actually have anything to do with the study. The results reported at the end of the study showed that there was improvement in many areas, such as bladder, bowel, and sexual dysfunction, the patient's ability to walk long distances, and the general perspective of positive health change. As absolutely wonderful as this is, the most impressive part of this research study is that in 15 out of 18 patients, the MRI scans post-treatment showed inactive lesions in their brain and spinal cord. This is groundbreaking and absolutely wonderful for this study to have found out. Treatment during using umbilical cord mesenchymal stem cells was shown to be positive, not dangerous, and absolutely something to look further into. Results from this treatment is an incredible step forward in curing this disease and shows more promise in the happiness and well-being in patients than any other treatment that we can offer currently. Thank you very much.